Calcutta Rescue is a health, education and development charity serving the most underprivileged people in Kolkata and West Bengal. Through a network of clinics, schools and outreach programs, Calcutta Rescue provides free medical treatment, schooling, job opportunities and training to over 100,000 people a year. Calcutta Rescue delivers free outpatient medical care to those who cannot afford treatment in government or private hospitals. Working alongside government programs, we provide treatment for a number of diseases and conditions such as leprosy, diabetes, HIV, disabilities, cancer and tuberculosis. Our two schools provide free education for over 500 pupils from the poorest families, preparing the youngest for entry into the government school system and sponsoring them once they enter into formal education and beyond. Our development programs provide vocational training for our former patients and pupils, equipping them with the means and skills to find sustainable employment to support themselves and their families in the long term. Founded in 1979, Calcutta Rescue began as an ad hoc street clinic run by British doctor Jack Prager on the pavements of Kolkata, providing diagnosis and treatment to thousands of the city's poorest people who had no other chance of receiving even the most basic medical care. Inspired by Dr. Prager's pioneering work, foreign volunteers began to help raise funds to reach more of those in need. 30 years later, this support has evolved into a well-organized and experienced network of support groups who together raise over €700,000 a year in support of Calcutta Rescue. Calcutta Rescue street medicine programs work in the heart of Kolkata's slums and street communities, delivering direct access to medical diagnosis, drugs and comprehensive follow-up care. Our team of doctors, nurses and health educators visit different communities around Kolkata week on week throughout the year, prescribing medication on the spot or referring them to further care and follow-up. Our clinics offer a holistic program of treatment, providing medicine, food packages, clothing and travel allowances to all our patients. All our clinics place strong emphasis on health education, with each and every patient given comprehensive health instructions in hygiene, childcare, sexual health and disease prevention and control. We run specific projects complementing Government of West Bengal's health services in the following areas. Tuberculosis under the World Health Organization's Direct Observation Short Course or DOTS program. Calcutta Rescue operates urban and rural DOTS clinics, providing TB treatment under the West Bengal Government Health Program, in addition to providing medication for multi-drug resistant and extreme drug resistant cases of TB not supplied by the government. Our Chitpur clinic supports the government leprosy eradication program by providing medical consultation and support to patients for associated conditions, wound care, physiotherapy, health education and food packages. Our Disabilities Department provides social care and support to over 100 patients and their families, providing basic medical care and referrals to government and NGO disability facilities. Our Mother and Child Health Program provides pre- and postnatal care to mothers and their young, offering health education, special feeding programs, family planning, and immunization. We also provide medicines, comprehensive support and follow-up to patients with thalassemia, cancer, and HIV. All our projects are supplied year-round by our central pharmacy and supply store, with our network of jeeps delivering drugs, food, and equipment around the city to our projects every day. Our two schools provide free education for over 500 pupils using the progressive techniques employed by the Loreto Montessori method which aims to make learning fun for children and encourages them to approach education in an independent and self-motivated way. Our schools equip children with the necessary basic skills in reading and numeracy to gain access to government schools, where we continue to support them financially and provide them with access to facilities for their homework and regular meals at our schools throughout the school career. We also provide funding for pupils to attend boarding schools when conditions at home do not allow them the opportunity to study. Calcutta Rescue provides development services for a number of its former beneficiaries, funding vocational training programs to equip them with the skills to set up their own businesses. Some of our former patients have been trained by Calcutta Rescue as beauticians, embroiderers, and mobile phone repairers. We also run our own Fair Trade Handicrafts project, which produces a wide variety of products sold in India and worldwide through our network of support groups. We employ more than 20 former patients and pupils trained in a number of different handicraft and embroidery skills. We have trained a team of former patients and pupils in weaving in a rural area south of Kolkata, who now produce cloth to supply both our handicraft units and schools with clothes, blankets and material, while also providing bandages for our clinics and medical projects. For 30 years, Calcutta Rescue has provided healthcare, education and development to some of the poorest people in Kolkata and West Bengal. Over the years, we have built the infrastructure, networks and team to provide effective and efficient services. Please help us continue to provide these services to our existing patients and pupils and reach even more of those most in need, regardless of caste, age, gender or religion. Donate now at www.calcuttarescue.org.